Having just come back from the States and spoken to Christine Pearson, who is the global founder of TLC, she's massive. You know, what she's done for the Trich movement is phenomenal. In America, they gear up a lot more to CBT, which is not so much available in this country. You can go to your doctors, you can ask for it. Whether you get it or not is a different matter. Sometimes it's a long waiting list, 9 months, maybe even longer. And schools of thought about it in this country vary from, you know, didn't really help much, well, that was quite useful. I'm just wondering if you girls have got an opinion on either having tried CBT, get CBT, have it done any good for you or not. What about you, Angela?
I did ask my GP recently about seeing a CBT specialist, and they put my name down, and I had to wait a few months for it. And when the appointment came round and I went to see them, they were very helpful, but they were only for 6 weeks. It was just a 6-week session, so what good that she did do just didn't last. If they were to do it, it would
You'd
be
like to see a
longer,
much more protracted treatment plan, a year or two at least.
At least,
yes,
at
because
least.
therapy
because it's not just like that. You need more time with things like this,
yes,
especially the longer you've done hair pulling. I think the longer you need it with the therapist,
yes,
to be able to talk about it and get the help.
Yeah. What about you, Anna? Was it good, rubbish?
I've had, once I got the courage together to actually speak to a GP, this was just before I met you, I was referred for therapy. And I had actually also worked it out for myself over the course of the years to try and keep a chart of when I pulled and how much I pulled and what areas I pulled from, to just try and control it. So I was already sort of doing that for myself. And when I went to go and see the therapist, he was sort of, well, that is the sort of basis of CBT. That's quite a good thing to do. But again, like Angela, it was I wasn't prescribed enough sessions for it actually to really sink in, for there be continuity. I think there has to be continuity in therapy for it to start working, especially if you've been doing something for so very long. You can't just stop it in a matter of a few weeks with a sympathetic ear here and there. You do need to do intensive work.
What about you? You had quite a good experience with CBT.
Yes, I've had some mediocre ones. It was again the 6 weeks. It wasn't actually a CBT specialist. It was just somebody who dabbled in it. But recently, I've been re-referred. It was a 9-month waiting list. Well, it was a year waiting list. I got seen after 9 months, and this has been a lot better. I think I don't know whether it's moved on since when I went before, but I've been prescribed 16 weeks if I need it. Well, 16 sessions, and you can spread them out. You can have a session every 3 months or every week, and you just
or once a
space
month
them out.
16 months.
Yes, and you space them out as you need them, and actually, like, they cut your sessions down if you don't feel you need them, or if you can't make one, they'll give you a telephone call and see how you're going. And I did find that really helpful.
Yeah, so there is this general consensus that the Americans have got it better. You know, we're very far behind in Britain today with treatments with TTM, but I think you've also got to understand with trichotillomania, we're still in the embryonic stages of talking about it through the medical profession. Yes, it's out on the internet, you know, and things are better. There's you know, if you do go to a doctor now, chances are he'll have heard of it. Yes. Chances are he can spell it, or she, and chances are you might be referred. You know, the backlog of the long waits and the short-term treatments aren't really as good, but the Americans have got a much better hold on things out there as a direct result, really, of Christine Pearson setting up this global foundation about the treatment of TTM, trichotillomania, and skin picking, which they lumped together in America, which was very unusual, I thought.